It is Thursday, October 22nd, 2020. And welcome to the Kahnawà COVID-19 Task Force update. It is our 144th, and we have an all-ladies edition today. We have Lisa Westaway will be here, also Don Montour-Lazare, but we'd like to start off with Ietsénhaienhs Gina who will be talking about developments with the Kahnawà Economic Relief Fund. Gina?
Well, here we are back in the red. It's been a while since I've been here. We've been looking at the needs of the community members throughout the upgrading into red once again. We've been getting a lot of inquiries, different concerns coming up. So we had made some modifications, and a press release went out last Friday indicating that people who can demonstrate a financial need can apply again to the KERM fund. People whose children will not be able to go to school due to COVID, or people who are in the need of a caregiver to assist them at home with their children. There is an amount of $150 that'll be available weekly. So it's important that you get in touch with the KERM at client-based services if you have any of these needs and you think you might fit the criteria. If you don't, give a call anyway. I've been getting some inquiries and people have been asking, and they do fit in that criteria. So I'm encouraging people, to give a call, and it's more efficient and quicker to call directly at the client-based services. We do have some numbers today. We are at the $7 million mark for the KERM relief, and we are slowly edging towards the $1 million mark for the business interruption fund. We are at $700,000. We do have an extension until January of 2021 for the relief fund, which I think is very important to, people out there wondering how long this will go on. There is, again, like I said, we're inching our way towards that 12 million. There's over 7 million that has been given out to date. We will have to reassess as things go along, but we know that along with the task force, are looking at what can be done to assist businesses in this time of need. We don't want to see a complete shutdown, and everything is being done to avoid that. So it's really important, that we be patient, and I know it's not easy. There's a lot of fears that have been going around, a lot of concerns. We get them at council, and everyone is legitimate. Now, if you have any fears of any sort, and you want to talk to somebody, there's also KSCS. It's very important. I've had some inquiries where people just needed somebody to talk to and some reassurance. We're happy to do that at council, but at the same time, there is the KSCS workers who are there and willing to assist in those areas. So it's important. No matter how minor you may think your concern is or your question is, definitely get it answered, because then you'll have some ease. Also, what will be coming in the future is Untitled is going to be looking at the needs of the business community, and they're going to be doing a survey. They haven't prepared the entire survey, but we're looking at long-term to help businesses, because the effects of what's happened now are going to be long-term, and we want to be in a position to service the business community. A lot of people are worried about where monies are going to come from and what the landscape is going to look like for them. And we don't know that. And that's why as we go along, we keep doing different surveys, questionnaires, and modifying the programs that we have. So right now we're fortunate. We have not used all the monies that are available. And again, we are in this together. We need to be patient with one another. We need to respect each other's fears. And let's do our best and work this out together. That
was very well put, Gina. Well, this time of the year is usually flu season, or the beginning of flu season. And guess what? Even though COVID is going on, there is still the chance that people could get the flu. And think about it. You might have two issues going on. So to talk about flu shots this year, we'd like to bring on Don Montour-Lazare from the Kahnawà Memorial Hospital Center. Don?
Wei. So every year we have flu vaccination clinics at the hospital, but due to COVID, we're trying to limit the number of people that are in the clinic. So we've looked at other options to help us be able to give the vaccines like we normally do, and make sure that everyone stays safe in the process. So we're going to be doing the vaccinations this year at the Legion in the downstairs hall. We will also not be taking walk-ins this year, so you'll have to book your appointment ahead of time. We're doing the booking this year online. There'll be a link on the KMHC website at kmhc.ca/flu clinic. We know that not everybody has access to the internet, so we're also made provisions so that someone at the hospital will be able to answer for people who don't have access to the internet. As much as possible, we're trying to encourage people to call their family members to try and book their appointments. But if you can't, you can always call KMHC at 450-638-3930 and ask for the switchboard operator or hit 0, and she will book your appointment for you. We'll be opening the online booking only next week, probably only Wednesday or Thursday. So just you can keep checking if you want. Anybody that shows up at the door, unfortunately, we're going to have to turn you away because we're really trying to keep everybody safe and really trying to pace the number of people that are coming in through the door so that we don't have too many people in the hall at the same time. So the people that should be getting the vaccine are, most people that are more risk for complications of the flu. So that would be, well, babies under 6 months are more at risk, but we can't vaccinate kids under 6 months. So what we need to do is we need to vaccinate the adults around them so that we can protect them. We also need to protect our elders, and the elders themselves need to get the vaccine, as well do pregnant women and people living with chronic conditions like diabetes, blood cancer, asthma, COPD, if immunosuppression or immunodeficiency of some sort like HIV, liver disease, kidney disease, extreme obesity, and any condition where you'd have a hard time bringing up any secretions. We also offer the Pneumovax vaccine at the same time, so if any people that kind of meet the criteria for flu would also be eligible to get the vaccine. But we would determine that at the flu clinic whether or not you qualify for the pneumonia vaccine. But you shouldn't, if you've already received it, you probably won't receive it again unless you received it before the age of 65 and you're over the age of 65. We would actually repeat it at that point. So when you go on to book the appointments online, we need you to book appointment for each single person. So you can't book one appointment for your whole family. You have to book an appointment for each person. You will be able to go on and book a whole series of appointments, but we really ask you that you book an appointment for each person. Because like I said, it's all about the spacing in the hall of how many people are in there. We're really limiting. When you go there, it's important that you bring your Medicare card or your hospital card so that we have identification for you. And we also have to register all these vaccines, and we use your Medicare card number as a way to register the vaccines. We ask that people wear a short sleeve shirt, so you can wear it under your jacket and that, but a short sleeve shirt makes it a lot easier for us to be able to give the vaccine as opposed to having to get people to undress and take off their shirt or roll up their sleeve as much as they can. So you can't roll up a sweatshirt all the way up to the shoulder, and we have to go way up in the upper arm. We ask also that if you have problems with getting vaccines or getting needles, if you get nervous or you have a tendency to faint or feel uncomfortable, it's very important that you say that to a nurse so we can make sure that we put you in a position that would make it safe for you so that you don't land out fainting on us and falling on the floor. So any child that comes in that's under the age of 14 must be accompanied by a parent. And if, let's say, the parent can't come and they send them with the grandparent, it's important that they get a signed consent to bring with them. We will be putting that on the booking site and as well as on KMHC and on our Facebook page so that you can print up a copy at home, read all the information that goes along with it, and sign the consent so that we can get the vaccine when your child arrives at the clinic. We're also trying to put in a lot of safety measures. Like I said, we're really limiting the number of people that are going to be coming into the hall, so that's one of the things that we're doing to keep the number to a minimum. Just the same as we do at the hospital. When you walk in the door, we're going to have someone asking you the questions about whether or not you have been exposed to somebody who has COVID, if you've been tested, if you've been in isolation, if you have any signs and symptoms of COVID. We'll be doing all that kind of thing. You'll be asked again, of course, to wash your hands with hand sanitizer when you walk in the door, and you have to wear a mask to come in. The staff also, everyone that's working there will be wearing masks, and the nurse that's going to be giving you the vaccine will also be wearing a visor as extra protection. And after every patient leaves, we will be washing the whole area to make sure that everything is nice and safe and clean, to make sure that there's no cross-contamination. The schedule of the vaccinations is going to be posted on our KMHC website probably by tomorrow, I would imagine. And there's quite a number of varied appointments, schedules that should be accommodating everybody. We have daytime appointments, evening appointments, and even on Saturday, a couple Saturdays to try and accommodate everyone. So one of the things that you want to look out for, one of the reasons why we're trying to push people to get vaccinated this year even more so, is because a lot of the signs and symptoms of the flu are very similar to the ones that we have for COVID. The signs and symptoms for flu are fever, cough, fatigue, headache, muscle soreness, and general feeling of illness, of not being well. Those things are also signs of COVID, and so it's going to be very difficult to tell the difference between having the flu and having COVID. And in our eyes, if you have these kind of symptoms, we have to rule out the fact that you have COVID. So it's important to get the flu vaccine so that you won't get the flu, and so that if you start having symptoms like this, you'll be thinking more about COVID as opposed to the flu. And like I said, in reality, if you had any of these symptoms, you should be calling in the COVID testing center at the hospital at 450-638-3930 at extension 2275 or 2296 to make an appointment. They will evaluate your symptoms and decide whether or not you qualify to get a test at that time. The other thing is that we want people not to get complications from flu as well. Complications like ear infections, sinus infections, bronchitis, pneumonias, and even death. Death is not as a big complication as it is for COVID, but we still see thousands of deaths a year in Canada from the flu. So it's important to get your vaccination. I know that through talking with people in the community, that there's been more people that are asking more about the flu vaccination this year. We will not run out of vaccine. If we do run out, it'll be very temporary. It's while I'm waiting to get more vaccines, but it's going to be paced as we go along because we can only have so many people in the hall at a time, and so we should be able to get through it without running out. Anybody who's at home, who's a home care patient, will continue to get their vaccines at home. The home care nurses will be going to the homes to give the vaccines. And if anybody's over the age of 70, like we've been doing for the blood test, we're encouraging you to stay home and calling the Elders Lodge and asking for the home care nurse to go give you your flu shot. At the same time, too, like the home care nurses have told me that usually what they'll do is they'll call the family and invite as much of the family to come to the house to get their flu vaccines. But because of spacing and because we don't really encourage people to to be going to visit other people, this year they won't be able to do that. So they're going to encourage that family members of home care patients, as much as possible, attend the clinics at the Legion. I think that's all I have to say for now. If you have any questions, you're certainly welcome to call the hospital, and you can even call the COVID testing center. Has been answering a lot of questions about the flu clinics. You can also call the COVID public health line at extension 2345 at the hospital. Now I'll go.
Thanks, Don. Lots and lots of information there. And remember, if you're watching this live or listening to it live on K1037, you can always repeat if you need to get any of the information, because like we said, there was plenty there. Speaking of information, Linda Westaway from the Kahnawà Memorial Hospital Center joins us. She's the Executive Director, and we welcome her once again. Lisa.
Thank you. Just a few quick updates. The first is regarding the testing site. So testing still continues. We'll be modifying the schedule again next week because the need for testing has decreased quite drastically over the last week or so. So we're now testing approximately 5 people per day. This could mean one of two things, either that nobody has symptoms and therefore no one is being tested, or it can mean that many people have symptoms but are not coming in for testing. So again, we encourage you, if you have COVID-related symptoms, that you do come in for testing, as this allows us to isolate, identify contacts quickly, and ensure to limit transmission of the virus throughout the community. We do not have any new cases to report to you today. So for those who have been tested, the results that we've received up till now have been negative. And we don't have any active cases that we are aware of in the community. So I wanted to give that information. However, it does not mean, again, that there are no positive cases in the community, because we can't say for sure if people are being tested and are being identified as they need to be. So our community health check continues to be moving along. We are having difficulty reaching some people, and therefore we will be doing some calls in the evening. So if you do get a call, please, if you get a call that says unknown caller, please answer your phone. Some phone lines do say that KMHC is calling on a caller ID, but that's not always the case. So we ask that you answer your phone and respond to the questions. For those who do not have a landline, please go to our website, either fill in the online questionnaire or send in your cell numbers so that we can get a good picture of what's happening in the community. So another reason why we feel it's important for you to be tested is so that if you do have COVID, you have our local public health team calling you on a regular basis just to follow up with you, see how your health is, and make sure that you're doing okay. This is important also for you to be aware if you have COVID, because there are sometimes long-term impacts or effects of the virus. And it would be important for you to understand, for your own personal knowledge and health, to be empowered, to be in control of your health, to understand what might be happening to you, and to seek the appropriate resources when required. So we do have some data now, more and more, that shows that there are some long-term impacts to COVID-19, even for people who have milder cases or who aren't necessarily hospitalized, such as the taste or smell not coming back at 100%, inability to exercise for long periods of time, some lasting tingling in fingers, some digestive problems. So these are just a few of the long-term effects that we're seeing in people who have had COVID-19 here in Kahnawake. So these aren't just research documents, these are real situations that are happening. And so again, it's another reason why we want to try as hard as possible to avoid getting COVID-19, to continue to put measures in place for hygiene, distance, and masks at all times, because we want to protect our health. We also, of course, want to protect those who are most vulnerable. Just a last comment that I wanted to make is with respect to our own personal choices. And we speak about that often, about making personal choices for our own health and safety. So what we're seeing now in this second wave, more so than we saw in the first wave, is a little bit of a relaxation in measures in businesses or businesses in the communities around us. So for example, in grocery stores during the first wave, they were really being protective of the amount of people who walked in the front door. They sometimes had you even clean your feet before you came in. Costco, they were cleaning all the carts. They had people at the front entrance. So in this second wave, we see that things are a little bit more relaxed, and therefore it is up to us, it is our responsibility to make decisions when we enter into a place of business about whether we feel we should stay or whether we feel that we're not safe. So Don, who spoke with you earlier, I hope you don't mind I'm mentioning your name, but was at Walmart this past weekend and really felt uncomfortable and unsafe within the environment, and therefore she made a conscious decision to not go back there during specific times of the day. So it's just an example of how we have to be careful. Yesterday, I had a delivery person come to my home. I did not order pizza, but somehow they ended up at my house. And the person delivering from Domino's was not wearing a mask. So that would be a situation where I did say to her, you need to be wearing a mask. And if I had ordered that pizza, I probably would not have accepted it. So those, again, are examples of choices and decisions that we are allowed to make as individuals, should we feel uncomfortable in any given situation. And that's why we mention that for Halloween as well, whether we want to open our doors or not, those are our personal choices. One last thing is about Anna LaBerge Hospital. So we did receive a little bit of information that we know that many of the hospital ERs are overcrowded. Anna LaBerge happens to be one of those hospitals that is over capacity right now in their emergency room. So what we're asking is that you really put some thought. Of course, if you need to go to the emergency room, you go to the emergency room. That is shouldn't even be a question. But for non-urgent, non-emergency needs, we urge you to contact KMHC and request to be assessed by the nurses and possibly have a visit or a phone conference with your physician before going to the emergency room if it's for a non-emergency case. So I think that we've spoken about that before, but a little reminder is always helpful, because we don't want you to be sitting in the emergency room for hours for a non-emergency, and we also don't want you to have to be in contact with other people in close contact for long periods of time if it's not necessary. So that's it for my updates today. Thank you.
All right, thank you very much, Lisa. And like I said, today's episode just chock full of information, all of it important, because we have to stay safe. Lisa mentioned personal choices, and I know one thing when you go into some of the stores, and in Kahnawà they're doing great, but yeah, outside I've only been out a couple of times, and I think it's a wise idea to bring one of those little hand sanitizers with you, because yeah, not everybody's as careful as we are. So let's continue to do the good work, and we shall stay safe. Remember, again, in Quebec today, over 1,000 cases, 20 people have died. There were more deaths in another of the long-term care facilities. So those problems are still out there, and that's why we continue to do the work that we're doing here in this community. Let's keep ourselves safe and each other. So with that, we'd like to thank you for joining us today. We'd like to thank our guests, Gina Deer, Don Montour-Lazare, and of course Linda Westaway, and we'd like to thank you. So we'll see you next time. Take care. Wanagiwahi.